Have you ever noticed an itchy spot on your skin that just won't go away? No matter how much you try to ignore it. A nagging little irritation you might pass off as dry skin, or maybe a reaction to a new soap. It's a feeling we've all had. But for those of us in our golden years, that seemingly innocent itch could be a critical warning sign. In fact, shocking new research suggests that for seniors, a persistent, unexplained itch could be your body's first and only signal of a serious underlying condition, like cancer, if it's ignored. And here's the frightening truth that isn't often discussed. What feels like a minor annoyance on the surface could be the silent whisper of a problem growing deep inside your body. But I'm not here to scare you without reason. My name is Dr. Evans, and for over 30 years, my entire career has been dedicated to the health of older adults. And I'm here to tell you that your skin is often the very first messenger when something is wrong. I'm not talking about theories from a textbook. I think about my patient, Michael, a 75-year-old grandfather. For months, his only symptom was a nagging itch on his legs. An itch that, once we finally investigated it, led to an early diagnosis that absolutely saved his life. In this video, we are going to walk through the 5 specific types of itching that you must not ignore. I'll explain in plain English what they mean, and more importantly, the simple steps you can take to protect your health. Everything we discuss today isn't guesswork. It's based on recognized medical patterns from decades of practice. And please, make sure you watch until the very end. Because the 5th and final sign is the one most often dismissed, even by other doctors. And knowing it could be the key to saving your life, or the life of someone you dearly love. So, before we dive in, I truly want to know. If what I've just described feels familiar, if you've ever had a persistent itch that truly worried you, please take a moment to comment a simple yes below. It lets me know you're here with me, and it shows the other wonderful people in our community that they are certainly not alone in this. Okay, let's get started. Alright, let's begin with the first warning sign. Sign number 1. Persistent itching on the lower legs. It's so incredibly easy, isn't it? To feel an itch on your shins or your calves and just chalk it up to, well, life. We think, maybe my skin is getting drier as I age. Perhaps it's the dry winter air in the house. Or maybe it's just a reaction to that new pair of socks I bought. Most of us, without a second thought, will reach for a bottle of lotion, rub some on, and expect the problem to simply go away. We've been conditioned to believe that a little itch is just that, a little itch. It's a minor annoyance, nothing more. But I need you to lean in and listen closely here, because this common assumption can be a dangerous one. When that itch on your lower legs refuses to leave, when it lasts for weeks or even months, and when it seems to get worse at night, disrupting your precious sleep, it may not be a skin issue at all. It could be a profound signal from deep inside your body. In my practice, I've seen this exact symptom act as the earliest warning sign for blood-related cancers, most notably a type called lymphoma. The science behind it is actually quite straightforward. When lymphoma cells begin to multiply, they release tiny inflammatory chemicals, called cytokines, into your bloodstream. These chemicals travel through your body and can irritate the delicate nerve endings just beneath your skin. And the dense network of nerves in your lower legs makes them particularly sensitive to this irritation. Now, this is especially critical for us as we get older. Why? Because our bodies change how they communicate. When we were younger, our body's warning signs were often loud, like a shouting fire alarm. A sharp pain, a high fever. But as we age, those signals often become much quieter. The body no longer shouts. Instead, it whispers. And this persistent, nagging itch is one of its most important whispers. This is why the feeling is so different from simple dry skin. It's not a surface-level irritation that lotion can fix. My patients often describe it as a deep, internal sensation, almost a burning, or a feeling of pins and needles coming from within the bone itself. It's a phantom itch that you can't seem to scratch. Let me tell you about a patient of mine, a wonderful gentleman and a proud veteran named Michael. He was 75, and for the better part of 6 months, his only complaint was this maddening itch on the front of his shins. He did what most of us would do. He dismissed it. He must have spent over $50 at the local pharmacy on every cream and ointment you can imagine. Cortisone, moisturizers, you name it. Nothing worked. Night after night, this relentless itch would wake him up, leaving him frustrated and exhausted. It wasn't until his yearly physical, prompted by his wife's loving persistence, that routine blood work showed something was off. His white blood cell count was abnormal. Further scans revealed enlarged lymph nodes in his chest, a classic sign of lymphoma. For Michael, that itch wasn't just an annoyance. It was the earliest clue his body gave him, appearing months before any other traditional symptoms like fatigue or night sweats. Because we caught it, and we caught it early, his treatment was far more effective. So, here is your simple, empowering action plan. If you or someone you love is experiencing an itch like this, one that is localized to the lower legs, persists for more than a few weeks, and doesn't get better with creams, please stop trying to fix it on your own. It's time to listen to the whisper. Make an appointment with your doctor. And when you go, be specific. Tell them, I have a persistent itch on my lower legs that gets worse at night. And then you can say, I've heard this can sometimes be related to other issues. Would it be possible to get a simple blood test, a complete blood count? It is a painless, straightforward test that could provide life-saving answers. Don't be afraid to advocate for yourself. This small step could make all the difference in the world. Sign number 2. Itching between the shoulder blades or upper back. Let's talk about a sensation that is uniquely frustrating. An itch in that one spot on your upper back, right between the shoulder blades, that you just can't quite reach. We've all been there, awkwardly trying to scratch it, maybe asking a loved one for help, or even resorting to a door frame. It's a common frustration, and our immediate thought is usually quite simple. We blame a scratchy tag on a shirt, maybe poor posture from sitting too long, or just the dry air in the room. We treat it as an external problem, something happening to our skin. But what if the problem isn't external at all? What if that itch is a signal coming from deep within your core? When this specific type of itch, a deep, gnawing sensation that feels like it's coming from under the skin, persists for weeks or even months without relief, it can be one of the most subtle and overlooked early warning signs of pancreatic cancer. I know that sounds frightening, but understanding the connection is the key to protecting yourself. The pancreas is an organ located deep within your abdomen, and one of its jobs is to help with digestion by producing bile. A tumor, even a small one, can press on the bile ducts, causing a blockage. When that happens, substances like bile salts and bilirubin, which are normally flushed out of your body, build up in your bloodstream. These substances are intensely irritating to nerve endings, and for reasons we're still studying, the dense network of nerves in the upper back is particularly sensitive to them. This is precisely why pancreatic cancer is often called a silent killer. The initial symptoms are notoriously vague and easy to dismiss. As we age, we get used to minor aches and pains, so we often ignore our body's earliest signals. We don't want to be a bother, or we simply tell ourselves, it's just part of getting older. But this itch is different. It isn't a surface-level rash. My patients who have experienced this describe it as a phantom itch, a crawling or burning feeling that no amount of scratching can relieve, because the source isn't on the skin at all. It's a signal of a traffic jam deep inside your body. I'll never forget the story of a patient named Susan, a bright 70-year-old woman from Florida. For months, she was plagued by this phantom itch right between her shoulder blades. She was convinced it was an allergy. She changed her laundry detergent, bought hypoallergenic soaps, and even spent several $100s on a new mattress, thinking that must be the problem. But the itch remained, a constant, nagging presence. It wasn't until a routine checkup for what she thought was minor fatigue that her doctor noticed her liver enzymes were slightly elevated in her blood work. That single clue led to an ultrasound, which revealed a small, early-stage tumor on her pancreas, precisely where it was pressing on her bile duct. That itch, the one she almost dismissed as a simple annoyance, was her body's most crucial early warning. It gave her the head start she needed for effective treatment. So, here is what you need to do. If you experience this deep, unrelenting itch between your shoulder blades or across your upper back, start by paying attention to other subtle clues. A primary one is a change in the color of your urine or stool. Because bile isn't flowing correctly, your urine might become darker, almost tea-colored, and your stools might become pale or clay-colored. When you speak to your doctor, be very specific. Say, I have a deep itch between my shoulder blades that won't go away. Then, ask them directly, Could we run a simple liver function panel to make sure everything is okay? It's a simple blood test that can reveal the very same clues that saved Susan's life. And if this information has surprised you, or taught you something new, please take a moment and comment with the word "wow" below. It truly helps me understand which of these signs are the least known, and it helps our whole community learn together. Sign number 3. An itchy scalp without flakes or dandruff. Alright, let's move to a symptom that is almost universally misunderstood. An itchy scalp. What's the very first thing that comes to mind for 99% of people? Dandruff. Our immediate reaction is to run to the pharmacy and buy a special shampoo. We think, maybe my scalp is dry, or maybe I'm having a reaction to a new hair product. We focus entirely on what's happening on the outside, assuming it's a simple dermatological issue. And often, it is. But when that itch becomes relentless, day after day, and you look in the mirror and see absolutely no flakes, no redness, no visible rash, that is when you need to start paying much closer attention. A persistent scalp itch without any visible signs of a common scalp condition can, in some rare but serious cases, be a signal from your body's immune system that something is amiss internally. It has been linked to blood-related cancers like leukemia, and also to skin cancers that can develop on the scalp itself. Here's why. In a condition like leukemia, the body produces an excess of abnormal white blood cells. This can create a state of chronic inflammation throughout the body, which in turn can irritate the vast and sensitive network of nerves and blood vessels on your scalp. The itch it produces is often described as a tingling, crawling, or even a light burning sensation that medicated shampoos simply cannot touch, because they aren't addressing the root cause. This becomes especially important as we age for a very specific reason. Many of us have spent decades under the sun, and as we get older, our hair naturally thins. This leaves our scalp, skin we often don't think about, exposed to years of cumulative sun damage. A small, itchy patch that you can't even see could be the very beginning of a skin cancer, like a basal cell or squamous cell carcinoma. It might not look like much, maybe just a tiny rough spot or a small bump that you mistake for a pimple. But if it persists, it's your body's way of saying, pay attention to this spot. I had a patient, Robert, a 73-year-old retired schoolteacher. He was a man who loved wearing his favorite wool cap during his morning walks. For months, he had this peculiar itch on the crown of his head. First, he blamed his shampoo and switched to a fancy, expensive organic brand. When that didn't work, he blamed his beloved cap and stopped wearing it. But the itch persisted, a constant companion every afternoon. He mentioned it in passing during a checkup for what he thought was just age-related fatigue. That combination of symptoms, unexplained fatigue and a persistent, phantom itch, prompted me to order a complete blood count. The results showed a very high white blood cell count, which led to a diagnosis of early-stage chronic lymphocytic leukemia. For Robert, his itchy scalp wasn't just a nuisance. It was the very first piece of the puzzle. So here is your very simple, proactive plan. The next time you visit your barber or hairstylist, ask them to do you a small favor. Just say, while you're cutting my hair, could you take a quick look at my scalp under the light and let me know if you see any unusual spots or bumps? They are often the first people to notice something amiss. Secondly, if you have an itch in one specific spot on your head that lasts for weeks and doesn't respond to any over-the-counter treatments, please make an appointment with a dermatologist. Don't just live with it. A simple visual check by a trained professional can provide incredible peace of mind or, if needed, catch a problem when it's small and easily treatable. Sign number 4. Localized itching on the chest or breast area. Now we need to discuss a sign that is critically important, especially for women, but for men as well. An itch on the chest or breast area. It is so easy to dismiss this one. We think, maybe my bra is too tight, or it's just a heat rash from sweating, or perhaps it's irritation from the laundry detergent I use. For men, it's even easier to ignore, often written off as just a random itch. We treat it as a trivial skin complaint. But a persistent, localized itch in this specific area can be one of the earliest and most deceptive signs of a rare but aggressive form of cancer called inflammatory breast cancer. What makes this particular cancer so dangerous is that it doesn't play by the usual rules. We're all taught to look for a lump. We do our self-exams, feeling for a distinct, hard mass. But inflammatory breast cancer often presents with no lump at all. Instead, it grows in sheets or nests within the skin's lymph vessels, causing inflammation. And what is one of the very first signs of that inflammation? An itch. A persistent itch that stays in the same spot day after day. This isn't an itch that moves around. It is stubbornly fixed to one area. As our bodies age, our skin changes. It can become thinner and more sensitive, which makes it even easier to mistakenly blame these symptoms on normal aging. But the signs of this condition are distinct. Along with the itch, you might notice the skin feels warm to the touch. It might look slightly red or pink, resembling an insect bite or a rash. And one of the most classic signs is a change in the skin's texture, where it becomes thickened, pitted, or dimpled, often described as looking like the peel of an orange. This is a crucial distinction. It's not just an itch, it's an itch accompanied by subtle changes to the skin itself. I remember the case of Carol, a 69-year-old woman who came to see me for what she thought was a stubborn skin rash on her right breast. It itched constantly. She had tried every cream imaginable, from hydrocortisone to antifungal lotions, but nothing gave her relief. During her exam, I noticed that while there was no lump, the skin in that area felt slightly thicker and had a faint dimpling that was only visible under certain light. That observation, prompted by her complaint of a persistent itch, led us to order a biopsy. The diagnosis was inflammatory breast cancer. Because she acted on that seemingly simple itch instead of just living with it, we were able to begin an aggressive treatment plan immediately. Her courage in speaking up about a minor symptom made all the difference. So, here is your clear, actionable advice. Once a week, when you get out of the shower, stand in front of a mirror in a well-lit room and simply look. Look at the skin on your chest and breast area. Are there any areas that look pink or reddish? Does the texture in one spot look different from the other? And most importantly, if you have a persistent itch that is focused in one specific place day after day, please do not ignore it. Call your doctor or your gynecologist right away. When you make the appointment, tell them exactly what you're experiencing. Say, I have a persistent itch and some skin changes on my breast, and I need to have it looked at. Be direct. Be your own best advocate. It is a conversation that could truly save your life. Sign number 5. Persistent itching in the anal or genital area. Alright, we have arrived at our 5th and final sign. I want to preface this by saying that I know this is a deeply personal and uncomfortable topic to discuss. And because of that discomfort, it is, without a doubt, the most ignored and dangerously dismissed symptom of all. I'm talking about a persistent itch in the anal or genital region. For so many of us, especially from a generation where these things simply weren't discussed, the immediate reaction is embarrassment. It's a private problem, one we feel we should handle on our own. We assume it must be a simple issue, perhaps poor hygiene, a reaction to toilet paper, hemorrhoids, or a minor yeast infection. We buy over-the-counter creams, we try to be more careful with cleaning, and we hope and pray that it just goes away. But when that itch becomes chronic, when it lasts for weeks and then months, a relentless burning irritation that resists every home remedy, it is absolutely essential to overcome that feeling of embarrassment. Because in some cases, this is the body's earliest and clearest warning sign for anal, vulvar, or penile cancer. The science here is very direct. These cancers begin with abnormal changes in the skin cells of these sensitive areas. This cellular disruption, along with the inflammation it causes, can profoundly irritate the extremely dense network of nerve endings located there, producing an itch that feels impossible to satisfy. Now, why is this an especially critical warning for older adults? Because the incidence of these specific cancers increases significantly after the age of 60. At the same time, other benign conditions that cause itching in these areas, like skin thinning due to hormonal changes or hemorrhoids, also become more common. This creates a perfect storm of confusion, making it incredibly easy to misattribute a serious symptom to a harmless age-related issue. The defining characteristic of a cancerous itch is its sheer persistence. It's not just an occasional annoyance. My patients have described it as a constant torment, an itch that can evolve into a raw, burning sensation that makes sitting uncomfortable and can completely ruin a night's sleep. It's an itch that simply refuses to be ignored, no matter what you do. I will never, ever forget the story of a patient I'll call Richard, a 76-year-old retired accountant. He was a dignified private man who suffered in silence for nearly a full year with persistent anal itching. He was convinced, absolutely certain, that he was just dealing with a bad case of hemorrhoids. He tried every cream from the drugstore, adjusted his diet for more fiber, and used cold compresses, all to no avail. He was far too embarrassed to mention it to me, or even to his wife. It wasn't until the discomfort became so severe that his wife noticed how much pain he was in while sitting and finally urged him to speak up. When he finally did, a routine colonoscopy and examination revealed a small, early-stage tumor in his anal canal. Because we caught it then, his treatment was far less invasive, and his prognosis was excellent. But he later told me, with tears in his eyes, that his own embarrassment had almost cost him his life. So please, I am asking you to listen to this with your heart. Let Richard's story be a lesson for us all. Here is your clear path forward. If you have a persistent itch in the anal or genital area that does not resolve within a couple of weeks with basic over-the-counter treatments, you must act. The time for self-treatment is over. You need to make an appointment with your primary care physician, a gynecologist, or a urologist. When you make the call, you can simply say, "I have a persistent skin irritation that I need to have checked." And when you are in the exam room, take a deep breath and tell your doctor the truth. Describe the duration and intensity of the itch. It is a conversation they have had hundreds of times before, and they will treat you with professionalism and care. A 5-minute conversation, as awkward as it may feel, can lift a year's worth of worry off your shoulders and, most importantly, could be the single most critical step you take for your long-term health. And now that you've watched this far, it shows me that you are truly committed to taking control of your health. To acknowledge that commitment, please take a moment to comment with the single word, "healthy," below. It's a declaration to yourself, and a wonderful way to encourage everyone else in our community. As we come to the end of our time together, I want you to think back to the stories we talked about. Think about Michael, the veteran with that relentless itch on his legs. Think about Susan, with that phantom itch between her shoulder blades, she almost ignored. And think about Richard, who suffered in silence for nearly a year out of sheer embarrassment. Today, I am so grateful to tell you that they are all doing well. They are enjoying their golden years, spending precious time with their families, not because of some miracle cure, but because they finally chose to listen. They listened to a tiny signal, a persistent whisper from their own bodies, a simple itch. Each of their stories is a powerful reminder that the smallest, most nagging symptom can often be the most important one. It's a tragedy that could have been, but was thankfully prevented. The core lesson from our talk today is beautifully simple, yet it's the cornerstone of a long and healthy life. Your body is always talking to you. The question is, are you listening? In a world that is so loud, so full of distractions, it is easy to ignore these quiet whispers. It's easy to say, "I'm too busy," or "it's probably nothing." But I am here to tell you, as your doctor and as your friend, never ever dismiss a persistent symptom just because it seems small. Your health is built upon the foundation of these small moments of awareness. And so, as we wrap up, we've explored 5 critical warning signs that can truly be life-saving. But this knowledge is only powerful when we decide to put it into action. So now, I have one important question for you. What is the one commitment you are making to yourself after watching this video? It doesn't have to be monumental. It could be as simple as, "I promise to ask my wife to check my scalp this weekend." Or, "I will finally make that doctor's appointment I've been putting off." Or even, "I will be more mindful of the small changes in my body." Please share your personal commitment in the comments below. Writing it down makes it real. It turns a thought into a promise. And by sharing it, we can inspire each other to take that first, crucial step. And if you found real value and true inspiration in our time together today, please show your support by giving this video a like. It's a small click for you, but it helps this vital message reach so many more people. To ensure you continue on this journey with us, and never miss another video full of life-changing wisdom, hit that subscribe button. It's more than just subscribing. It's joining a community. A community of friends dedicated to living our best, healthiest lives together. Finally, as you finish watching, think of just one person in your life who needs to hear this message today. A spouse, a sibling, a dear friend. And please, share it with them. That simple act of caring might just change their life. Thank you so much for your time and your trust. Stay healthy, stay aware, and I will see you in the next video.